Hello everyone. Today I'm going to talk about arthritis. So I will be discussing two types of arthritis: rheumatoid arthritis or RA, osteoarthritis or OA. I'm going to discuss some of the similarities, which is pain, stiffness, weakness and depression between these two arthritis, and I'm also going to discuss some of the differences between these two types of arthritis. Rheumatoid arthritis is an autoimmune disease, which means the immune system by mistake attacks the joints in the same way that the immune system normally fight with virus and bacteria. In osteoarthritis is a local disease which is not caused by inflammation, so it is due to overuse of the joint. So it can happen in an older age. It can happen to a sports people who overuse their joint or a dancers who overuse their joint. In osteoarthritis, the reason is a break in cartilage because of the overuse, and which results in pain, stiffness, and which further causes a weakness and leads to depression. So in both type of arthritis, they can go into a depression. Let's talk some of the differences. For this, we'll ask the question to ourselves. The first question is where it hurts. So in a rheumatoid arthritis, it's a symmetrical disease, which means the joints are affected equally on both sides. So if the right wrist is affected, then the left wrist is also going to be affected. So it's a systemic disease. The osteoarthritis is not a systemic disease. There is an asymmetry between the joints, so between the affected joints. So if left wrist is affected, it's not necessary the right wrist is also going to be affected. There may be a left knee or right wrist, so wherever, it's a random. Okay. The other question is when it is worst. So when the pain is worst. In a rheumatoid arthritis, pain is more worst after the period of inactivity. So if they are, let's say if they are sleeping whole night, so they will have a worst pain in the morning. So once they start doing activity, the pain will slowly reduce. In osteoarthritis, the pain is more worst after the use of the joint. So most of the time they have worst pain around 3 p.m. The joint feeling. In rheumatoid arthritis, the joint is usually warm, there is a redness, and it's because of the inflammation. In osteoarthritis, the joints are large, there is a damage, they usually feel cool. The course of disease. In the rheumatoid arthritis, there is a remission and exacerbation. So they may have a flare of symptoms for a while, and then for a while they will have no symptom. So we call it a remission and exacerbation, and remission and exacerbation. In osteoarthritis, it's a slow onset and then it gets worse and worse and worse. So these were some of the differences between these two type of arthritis. The treatments is most of the time is a similar. They get NSAIDs, aspirin. There are gold compounds can be used in both cases. They have anti-malarial drugs which will help specifically for autoimmune disease. Methotrexate is given. And then if the joint is worst, usually they go for a surgery for the replacement of a joint. Okay, so I'll stop my video here. If you have any question, please contact me. Thank you so much for listening my video.